today we're going to run through the full physical exam. I have come up with a way that I thought was, wow. Thanks. Is this for you? Wow. So hopefully all of your SPs come in the same way. That would be great. That's true. Helen walks in and takes off the top. That's going to be sweet.
You're welcome. You're real bread.
I appreciate that. I know, my goodness. Well, I might need a minute. You made some money, however.
I'll pick that up later.
Okay, so in your exam, you will have an hour to complete the exam. The main rules are, A, you have an hour, so don't take longer than that. And B, we only want 3 position changes for your patient, okay? So sitting, laying down, standing. Try not to do more than that. So I try to put it together in a way that will incorporate that. You can do it in any order you want to. It doesn't matter, whatever flows best for you. But just try to make sure you stay within those 3 body position changes, okay? I'm not sure I can even do this now.
Would you like me to put on some longer shorts? They can just see things much better.
Yeah, that's true.
Yeah.
You will, I do need to take off your shoes at some point, though. So whenever
Can you swing those around?
yeah, I thought you would throw those at me. That would... Okay. It does have to be memorized. I don't know if I told you that part or not, but I assume you guessed it did. So, I don't have it memorized today because, you know, it's not my grade or whatever. One thing I will tell you, though, don't stress out too much about it. I want you to stress out a little bit about it just so that you will actually do okay. But keep in mind, every single one of these counts as a point, and you have to miss a ton of them, like 50. You have to miss 50 things in order to not pass this exam. So don't freak out too bad about it. I'm sure you'll be fine. And they are recorded, so if for some reason the SP gives you a grade that's not passing and you're like, I know I did that one thing, we can go back and watch and see if you did or not.
And you go, no, you didn't.
No, Billy, see this? That doesn't count. I don't know what you thought you were doing, but that's not it. They just...
Two in the room?
Sometimes there are, but sometimes they've been trained to do this for the medical students, so they have it memorized. They know all the things. And then they have the computer that pops up and they go through and click, yeah, you did that, you did that. And a lot of times if they don't remember, they'll go, I probably did that. And they'll get so it's nice. Okay, so let's get started. First of all, general appearance. Fabulous. Be sure and wash your hands. We're going to pretend I'm washing my hands. I guess I probably should have something over there. Okay, my hands are all washed. Good morning, Mr. Patient. I'm Shelley. I'm a PA student. I'm going to be doing your physical exam today. You look fabulous, by the way. Very nice. So first I'm going to get your vital signs. I'm going to check your pulse initially, so just kind of relax here. Find your pulse. Okay. And I'm going to check it for 15 seconds, right? And then multiply by 4. And then without telling the patient, I'm going to just continue to hold my hand here while I'm watching respirations for another 15 seconds.
We should probably tell our SPs though, right?
Yes, probably. Yeah. Or at the end, just say, and your pulse was this and your respiration was this. And then they'll know you did it. Okay. I would encourage you should probably check both sides at the same time because the SPs are trained for you to do that. This one might be dead. That's fine. Okay, so I've done pulse and respiration. Now I'm going to check your blood pressure. You only have to do this on one arm during this because it will take too long otherwise. Does everybody remember how to do a blood pressure, or do you want me to demonstrate?
Should we verbalize that we do it twice?
Yeah.
Or bilaterally?
Yes, and that's a good point. So all of these things where you would do it bilaterally, just verbalize and say, and then I would do the same thing on the other side to check. Okay, so let's pretend we checked it. Blood pressure's perfect. 128/80.
Sounds perfect.
It is perfect.
Shelley,
Yes.
do we have to do the whole thing where we go like 20 above, where we feel their pulse? And
No.
we go 20 above?
No, you can just check the regular blood pressure.
Okay.
Yeah. You mean pump it up and then tell you?
Yeah.
No. Now, if you can't hear it, then you have to pump it up farther until you can hear it.
Shelley,
Right.
I
Yes.
have a question on the intro. When it says state, health, and awareness, speech, all that, are we verbalizing all of that to the SP about
Right.
their appearance and
Right.
all that?
So you'd walk in, you'd wash your hands, you'd say, hi, I'm a student. I'll be doing a physical exam today. First, I'm just going to do a quick inspection. You don't appear to be in any distress. You appear to be breathing normally. You appear your stated age. Yeah, all that kind of stuff. And a lot of this stuff you'll have to verbalize like on ear exam because they can't see it. They don't know what you're seeing. So make sure you do that. Okay. Now I'm going to do a mental health exam for you. You don't necessarily have to tell them that. But okay, can you tell me what year it is?
2014.
What season we're in right now?
You can't tell here.
I'm going to mark down patient will not cooperate. Do you know what the date is today?
11.
Of what month?
April.
Okay, very good. And what day of the week is it?
Friday.
Yes, Friday. What state are we in?
Oklahoma.
What county?
Oklahoma.
What city?
Oklahoma City.
Do you know what building we're in?
Family medicine.
And what floor are we on?
First.
Okay, excellent. I'm going to name 3 things and I want you to repeat them back to me, okay? Cat, grass, caterpillar.
Cat, grass, caterpillar.
Okay, very good. Now remember those. I want you to spell the word world backwards.
No. D-L-R-O-W.
Excellent. You did a very good job with that. Can you tell me what this is?
It's a watch.
Okay, very good. You're supposed to say fabulous watch.
Fabulous watch.
Okay.
Black granite pencil.
Very good. What were those 3 things I told you a second ago?
Cat, grass, caterpillar.
Very good. Okay. Now I'm going to ask you to do a 3-stage command for me, okay? First thing I want you to do is, number 1, take this paper from me in your right hand. Number 2, open it up. And then number 3, do whatever it tells you to do on the inside. Okay?
That's cool.
Okay. So I've gotten him to close his eyes as well, so we got that step as well. Okay, on the back of this paper, you'll notice a design. Could you copy that design for me, please?
It won't be as pretty as yours.
Well, I am an artiste.
Shelley, are the SPs going to criticize what design you have in your
They shouldn't.
I'm just curious.
Okay, that's pretty close. Very
That
good.
is pretty.
Can you repeat the statement, no ifs, ands, or buts? Okay. Can you now write that sentence for me? Okay, so did we get everything? We wrote a sentence. No ifs, ands, or buts. The design, the stage command. Okay, very good. You appear to be slightly mentally competent. Okay, go ahead and sit up on this table for me, please. I'm going to sit down so you guys can see a little better. All right. The first thing I want you to do is pat your knees with your hands. Okay, now back and forth as fast as you can. Good. And now can you touch your thumb to each finger? Very quickly. All right, very good. Now I want you to tap your toes. That and the other one. Excellent. Good. Now what I want you to do is I'm going to put my finger up here and I want you to touch your nose and then touch my finger. Okay, now I'm going to move it and you keep going. Very good. Now can you take the heel of one of your feet and rub down your shin? Excellent. Okay, very good. Now we're going to check your reflexes. First I'm going to do your triceps, so let me see your arm. Turn it out this way and just let me hold it. Just kind of relax it there. Are you relaxing it?
I'm trying.
Okay. So what you want to hit is right behind where the elbow sticks out here. Relax really good. Oh, excellent. Everybody see that? Okay. Okay. Now brachioradialis, I'm going to have you relax your arm right here. I'm going to put my thumb right here on that tendon I can feel. Push in a little. Oh, nice one. You're a really good patient. Biceps, I'm sorry. Thank you very much. Okay, so brachioradialis, I'm kind of put you in the same position, but I'm going to push right up along in here. Excellent, that one worked too.
You sound surprised.
I know, yeah, normally they don't work. Okay, so we're going to do patellar, right below the kneecap.
kick in the head.
Those work really well.
I moved out. Are you just doing that?
No, I swear.
Okay.
I know.
He is. He's got a lesion. Okay, so on the ankle or Achilles, what you want to do is say relax your foot, and I'm going to kind of hold it up like this in my hand, and then you're hitting the back of the Achilles with the big part of the hammer, and you'll feel his foot push against you. So that's how you do that one. Does that make sense? Babinski, hold your foot up here and just kind of relax it. I'm just going to gently pull it. Oh, that one doesn't work. Maybe I didn't do it hard enough. Sorry. If you have a motor neuron. And then ankle clonus is similar to Achilles in that just kind of relax. You just want to push up hard and make sure he doesn't have that flapping motion against your hand. So that's all you're doing. If the foot just sits there, then that's normal. Did you guys see that okay? Do you need me to get on the other side and do them? Yes, get on the other side, or yes, we saw it.
We do have a video going, just so you guys know. I'm gonna post on YouTube.
Oh, good. Right here. And this, that's awesome.
I hope you got the first part.
I
Okay,
did.
so we got
I
patella
did.
fine. Ankle, again, kind of hold his foot up, and then with the wide end of your hammer, you're going to hit over the Achilles tendon, and you should feel it push against your hand. Ankle clonus, you just push up briskly and firmly, and make sure his foot doesn't do against you like this. Okay, very good. All right, we're going to do some more neurological tests. Can you close your eyes for me and hold out your hand? One. Can you tell me what that is?
Penny.
How did you know it was a penny?
I saw it.
Okay, now I'm going to draw a number in your hand, and you tell me what number it is.
3.
Excellent. All right. Now we're going to do. Okay. With your eyes closed, I want you to tell me if you can feel 2 pokes or 1 poke. Okay. All right. And this is what I'm going to put it on your hand first. That's what it'll feel like.
2. 2. 1.
Okay. You don't necessarily have to do both sides. You can verbalize
2.
that you do both.
2. 2.
Okay.
1.
Oh, it's a little better on this side. You got closer. Okay, now what I want you to do is I'm going to touch you somewhere on your body, and I want you to touch the same spot, okay? All right, good. Excellent. All right. And now I'm going to touch you again, and you tell me if you feel this only on 1 spot on your body or 2 spots, okay?
1.
Okay.
2.
Excellent. All right, did we get everything on that? Okay, you can open your eyes now for a second. Okay, now we are going to do sharp and dull. Whenever I poke you, this will be sharp, and this will be dull. Okay, so close your eyes again, and then you tell me what you feel. So just pick 2 places on the face, 2 places on the arm. You can do 2 places on the thigh. The SP doesn't want you to go through the whole thing, okay, because that will take forever. All right, tell me what you feel.
Sharp. Dull.
Okay.
Dull. Sharp.
Okay.
Sharp. Dull. Dull. Sharp. Sharp. Dull.
Okay, good. And that's all you have to do on that one. Okay. Now we're going to do vibratory sense. I want you to close your eyes again. Lay your hands out flat like this for me. And I'm going to place this tuning fork somewhere on a joint, and you tell me where you feel it, okay? Okay, good. Now I'm going to do the same thing, and you tell me if you feel it again on another joint. Okay, good. Now keeping your eyes closed, and have your finger here. Just kind of relax it. Tell me if your finger's up or down.
Up.
Okay, how about now?
Down.
Okay. Same thing on your big toe.
Down.
Okay, how about now?
Up.
Excellent. All right. You are neurologically intact so far. Okay, did we get everything on neuro? See if the next, okay. Skin, of course, you'll just verbalize, but you can kind of look. Say, I'm going to check your skin now. I'm just looking for any lesions. I don't see any abnormalities. I'm going to look here on your joints for any swelling. Anything else? You can actually do, you're nicely tanned, it's fantastic. You can do skin turgor, just pull on the hand. Your SPs may actually have a bit of turgor intent there for a while. Okay, hair distribution appears to be normal for your sex and age. Okay, so now we're going to inspect your head. So I'm going to inspect and palpate. I don't feel any lumps or bumps anywhere. I'll try not to mess up your cloth. Normal. Okay, now I'm going to ask you to do a few things for me. Smile for me and show me your teeth. Okay, can you frown now? Can you raise your eyebrows? Now wrinkle them down. Close your eyes, which you already kind of did on the neuro exam, but I can ask you to do it again. Now puff out your cheeks and hold them and don't let them push in. Okay, very good. I'm going to palpate your muscles here a little bit. So I'm palpating temporal and masseter. Can you clench your jaws? Very nice. Okay. Now while I'm here, I want you to open and close your mouth for me. I'm going to check your TMJ. Good. And can you move it from side to side? Good. And then protrude out and back. Excellent.
Do the back one.
Okay. I didn't feel any crepitus. Did you experience any pain with that? All right. Excellent. Okay, slip off your glasses for me, please. I'm just going to inspect your eyes. Go ahead and close your eyes for me for a second. I don't see any lesions. I'm going to gently push on your eye to make sure they are firm. Okay, good. Look at me again. I'm checking for alignment. You can also shine a light in the eyes to check for alignment. This one's not very big, you can't see very well. So when you shine the light, you should be able to see at the same spot on both eyes. If one eye's a little wonky, it'll be down a little bit. Okay, now to check your visual acuity, I would like you to gently cup one eye for me and hold this at arm's length and read the smallest line you can read. Of course, I understand you don't have your glasses on.
This is for CFDHJ.
That's really good. Okay, let's try the other one.
Oh, no. I can't even write that. EPTZO.
Excellent. Just on one of them, I think. Okay, good. Okay, now we're going to do a cover test and make sure that you don't have any strabismus or anything wrong with your eye. So look straight ahead at me. Just keep looking straight ahead. I'm going to cover this eye. And when you cover, you're looking to make sure this eye doesn't suddenly come to the front. And then when you uncover, you make sure this eye isn't suddenly going back again. Okay, that was perfect. Now I'm going to check your peripheral vision. I want you to look straight ahead at me, but I'm going to hold up, what do we say, 1, 2, or 5 fingers, okay? You tell me how many you see. See any?
I see them down there. I just don't know how many fingers you have up there. 2.
Okay.
1.
Okay.
5.
Good. Excellent. Extraocular movements, keeping your head straight. I want you to follow my finger. So here we're looking for nystagmus, and he has a little, but remember that's normal, just a little bit. They don't continue to go. Good. Now keep looking at my eyes. I mean, looking at my finger. Stare deeply into my eyes. So I'm looking for accommodation and convergence. Whenever my finger gets closer to his nose, both eyes should go in together equally, and then his pupils will also get smaller. That's what I'm checking for there. Okay, now I'm going to check your pupils again. You may want to turn the light off for this exam in the room because it's a little bit easier. So first of all, just look straight ahead, and I'm going to make sure that this pupil constricts when I do it. I do it again, this pupil also constricts. So that's direct and consensual. Good. Okay, so the fundoscopic exam is one of those things that you will have to just say what you're seeing. Okay? Have the patient look straight ahead at the object. Put your hand on their head so that you don't run into them. Remember, right eye to right eye, left eye to left eye. We're all friends here, but you don't want to get that friendly, maybe. So anterior chamber, you just shine sideways. Should be nice and clear. Okay, just keep looking forward. I'm going to find the red reflex. And then I'm going to go in a little bit closer. And here you'll just have to say what you're seeing. Say, oh, I see blood vessels. I don't see any nicking or silver wiring, as if I could really see that in real life anyway. The cup to disc ratio appears within normal limits. So that's what you're doing. And then you could ask the patient, you could say, and I would repeat that on the other eye, would you like me to do that today? And they'll probably say no, just go on. Okay, any questions on the eye exam? What did I miss? Anything? You don't have to do corneal reflexes either. Just verbalize. Yeah. Okay, so ears. I'm just going to inspect your ears now. There's the same spot on your head, which is good. I don't see any lesions or abnormalities. Is there any pain when I palpate your pinna like this? Okay, good. Let's take a look. Do we want in first, or do we want to? I'm going to do Weber next. Now what I'm going to do is I'm going to hit this tuning fork and put it on top of your head, and you tell me if you can hear the sound in both sides equally or better in one or the other. Okay. Can you hear it? Okay, we're ready to hear from us. Good answer. Okay, now I'm going to do another exam. I'm going to hit this again and put it behind your ear. You tell me when you can no longer hear it, and then I'm going to put it in front of your ear, okay? So I'll say, oh, I can no longer hear it. Okay. Okay, now I can no longer hear it. And then I'll say, okay, that was normal because it was a 2-to-1 ratio, so that appears to be the normal limits as well. Okay, now I'm going to look in your ears. Any questions about any of those, Weber, Renee? That? Yeah. Okay.
Can you do the finger rub instead of the whisper?
You can. You can do rub or whisper. Yes, thank you. So close your eyes and tell me which side you can hear this noise on. Okay. Good. Or you could whisper. I think you should do that to your elderly SP. That would be really sweet.
Especially if you're a cute
That'll make her
guy
happy.
like Alex and it's a lady. She'll be so smitten.
Okay, so I'm doing my otoscopic exam. Again, I like to hold it like this so that I don't accidentally jab the patient. Pull up on the pinna a little bit, take a look, and then just verbalize. The extraocular canal is free of any lesions. I don't see any purulent drainage. The TM is pearly gray. I see the cone of light that points at the bottom of the malleus. Everything looks awesome. And then you can have the patient say, just hold your nose and blow, please. I'm going to look at your tympanic membrane. Good. And we'll pretend that happens. Because most of the time you're going to forget. Okay, so nasal exam. I'm just going to look externally. I don't see any lesions, any abnormalities of the skin. Your nose appears to be aligned well. It doesn't appear you've ever broken your nose. I'm going to inspect internally. Can you tilt your head back just a little? And I always just pull up the tip of the nose because you can see better. And then again, verbalize. Your nares are patent bilateral as far as I can tell. Can you hold one side and breathe in for me? And the other side? Good. Now, I would also, and you just verbalize this, I would also check cranial nerve 1 at this point, his olfactory nerve, and have him smell different things and see if he could. And that's what you tell your SP. Okay, turbinates are not boggy or enlarged. I don't see any polyps. I don't see any foci for bleeding, blah, 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 all that stuff. Any questions on the nose exam? Okay. Again, inspect mouth. You have lips. That's excellent. You've got 2 of them. They are symmetrical. I don't see anything abnormal. Go ahead, open your mouth for me, please. Okay, and again, verbalize. I see the buccal mucosa. It is glistening and pink. I don't see any lichenification or lesions. The tongue appears to be have normal papillae length. I don't see hairy tongue or anything. Oropharynx, tonsillar, no tonsillar hypertrophy, no ulcerations or exudates, anything like that going on. Please say "ah" for me. Okay. And then you can say, and I would also check the gag reflex at this point with the tongue depressor. And if they say "okay, go for it," then you can go for it and do that part. They may want you to. Okay. Also verbalize. I would check taste. Okay. So neck. Everything looks symmetrical. Can you look up at the ceiling for me? I don't see any bulging around the thyroid. I don't see any thyroid enlargement. So again, remember how you check for thyroid enlargement? Do you guys have a question up there? Do you guys have a question? Okay. Don't make me send Eric over there. He's French. You know how they are. They'll go, sacre bleu! Okay, so to check the thyroid gland, find the sternal notch, and then about 2 finger widths above, go just over to the side of the trachea, push in and swallow for me. And then you do the same on the other side. So while I'm here, I'm going to go ahead and check lymph nodes. And again, you just palpate all over. Occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, anterior cervical, above the sternocleidomastoid, posterior cervical. I'm sorry. Yeah, that's right. And then clavicular. Okay, then we want to check epitrochlear. I'm going to check from behind. Normally you'd be beside the patient. And again, you would kind of have their arm resting on your shoulder. You want to check posterior, inferior, right under the pectoralis muscle. Make the whole box under there. Not ticklish?
I'm trying to compose myself.
Good, I appreciate that. And then you can verbalize that you check the other side as well. All right, we're cruising along. Oh, not that way. Okay. Any questions on lymph nodes? Because we'll do the femoral and everything when we get to abdomen down there. All right, so I'm going to inspect the shape of the chest. Looks fantastic. I don't see barrel chest or anything else going on. You want to palpate. And remember, you can do this front and back at the same time by just kind of rolling your hands like this. I don't feel any crepitus. Can you put your arms out to the side? Okay. Tenderness there. Okay, very good. CVA tenderness. I'll do that while you're sitting here. Any pain when I poke on your back like this? Okay, excellent. So then you also want to percuss. It's been a long time since we percussed anybody, isn't it? Keep in mind on chest, you do 2 anterior, 1 lateral, and 3 in the back. Okay, so percuss. Make sure I'm in between a rib. And then do the same spot on the other side. Okay, and then you do 1 laterally, and then you do 3 on posteriorly. And remember, you're comparing side to side, whatever anterior and posterior.
Do we have to percuss with the reflex hammer?
Do you have to do what?
With the reflex hammer, or can we just use
No,
the
you can use
finger?
your finger if you prefer. I can't get a good handle on it if I don't do the reflex hammer. I don't get any noise unless I do the reflex hammer.
Okay.
That makes me feel better. 'Cause
Okay, and then auscultate the same thing. So you want to do 2 in the front, 1 on each side, and then 3 in the back. Okay? Then special test. What I would say to the SP is, after auscultation, if I found an area that was abnormal, then I would do some special tests. And first of all, I would listen in that one spot that I thought was abnormal and have the patient say E. Okay. Okay, and then I could do bronchophony. Say ABC for me.
ABC for me.
Okay. And then whisper ABC. Okay, good. Anything else on there we missed?
Can you remind Shelley if like they had pneumonia and you did the E?
The
That
E
sounds like,
it would be more clear. It'd be more like A.
Okay.
Yeah, you'd really hear it.
and then
louder.
the bronchophony would be clearer,
Yes,
and the whisper would also
you would be able to actually hear it.
Okay.
Yeah. So all these sounds will be more clear to you if they have a pneumonia or some kind of edema, something like that.
Sound transmission, not air,
Right.
or through the fluid.
Right.
Okay.
Do you do the premise regardless, or is it considered a special test also?
It's considered a special test. I don't know why I put it up there. I don't know why I didn't put it under special test, but yeah, I'm sorry. Thank you for reminding me. Okay, can you say 99 for me?
99.
Okay, and again?
99.
Yeah, I should put it down a little bit. Any other questions on lungs?
I have a question. Are we taking in our own papers to give to them, or?
No,
Okay.
they're gonna do it on the computer, so there'll be no papers that you need. Okay, so heart. Again, I inspect, looking for any pulsations. I don't see anything abnormal there. Palpate aortic, pulmonic, right sternal border, tricuspid area, mitral valve, PMI. I'm gonna feel around there. You shouldn't feel any of these, right? We shouldn't feel any kind of pulsations or anything abnormal. Good. Auscultate with the diaphragm and bell in all of those places. So do diaphragm first. Then turn it over and do the bell. Pretty easy squeezy. I'll go ahead and auscultate for your carotid bruit. and have the patient hold their breath. Because if they don't hold their breath, then you just hear breath sounds through there instead of their actual heartbeat. And then I would say, if I heard anything abnormal on the heart exam, then I would have the patient do a couple of special maneuvers while I'm listening. I can have you lean forward for me and see if that makes any difference. Take a deep breath. Okay, now blow it out really good. Good. So you just verbalize all those things. You don't have to make them. All right. Musculoskeletal, my favorite. You can put your glass back on if you want. Before we knock them off. Okay, so C-spine, I want to inspect and palpate. You can do that from the front or the back, although technically you can't see very well from the front. So I'm inspecting, just palpating along the paravertebral muscles, trapezius muscles. And now I want to check for strength and range of motion. Can you tuck your chin to your chest like you are? Now hold it there for me. Okay, now can you look up at the ceiling for me? And don't let me push you forward. Okay, can you touch your ear to your shoulder here? You can. Hold it there for me. And then you do the other one as well. Okay, other side. Okay, now twist your hand. Twist your head toward me. Okay, and don't let me push. Good. And the other way. Don't let me push. Good. Okay, so that's range of motion. Okay, it's shoulders, inspect, shoulder girdle. Don't see any abnormalities here. Everything looks fantastic. Push up against my hands. And shrug. Okay, very good. Now, for range of motion of shoulders, of course, you know, put your arms out to the side for me, like this, and hold them right there. Yeah, I'm sorry. We're just doing abduction. Just hold them still.
Oh, girl.
And can you put them all the way up top of your head?
We're doing cheerleading.
We are. You're very good. You're very good. Okay, so can you go across your chest like this and hold it there and don't let me pull it down? Okay, very good. Now can you put your both hands behind your head like this and hold them? Don't lace your fingers. Just hold it like that. And don't let me pull down. Okay, can you put it back behind your back like this? And hold it for a second. Don't let me pull it out. Okay, very good. So just do your resistance while you're doing the range of motion, and that will go fairly quickly. What else do we need to do before we do the special maneuvers? Okay, we'll do that in 1 minute. Okay, so now what I want you to do is I'm going to do the supraspinatus, thumbs down, okay? Right here, hold right there, and don't let me push them down. Okay? I am very strong. So drop arm, I'm going to put you can put your thumb down if you want. I'm going to hold your arms here, then I want you to very slowly lower them down to the table. Okay. And if you had a rotator cuff tear, you wouldn't be able to do that. It gets about right here, and then it would just drop. Okay, now we're going to do apprehension sign. Scooch down here toward the end. Get to you better. Squooch. All right, so apprehension sign. Kind of relax your arm just like this. I'm pulling back with this arm and pushing forward on his shoulder. Is he doing the face? No? Okay, good.
There's a face.
There's a face, but it wasn't that one. Okay, so near sign. I'm going to twist your arm like that, and we're just going to bring it up beside your head. Any pain there? Okay. Now Hawkins, do this way. And I'm going to kind of twist forward. Any pain there? Okay, excellent. Drawer sign is going to be this. Just kind of relax your arm now.
Is near supposed to be passive?
No.
Okay.
No, they can all be. Oh yes, passive. I'm sorry.
Okay.
Yeah, they're not all active. They're all passive. So you're moving their arm for them everywhere. I'm going to hold here. Just try to move the shoulder back and forth. No lax. Any questions on any of those? Those are a little confusing with all the names.
Did you modify his hand position like this? Is that what you?
Yes, to do nears. Mm-hmm. So thumb down and then pull up. I thought y'all had questions there for a minute. I was like, oh, dang. Darn it. And then we already did crossover whenever he did adduction. So, good. Okay, so elbows. I'm just going to inspect your elbow. Just kind of relax it here for now. You're carrying angle, although it's hard to tell when they're sitting down. I'm going to palpate. see if there's any pain. While I'm here, I'm going to catch that epitrochlear node here. I don't feel any swelling in that area. Okay, can you pull your arm up like this and hold it there? Don't let me push down. Okay, and then push down against my hand. All right, just straighten it all the way up. Okay, good. Now I'm going to check supination and pronation against resistance. Pretend like we're going to shake hands, and don't let me move your arm back and forth.
I know.
You can do this. Anything else? I love elbow because there's like nothing really that you have to do. Okay, now I'm going to check your hands and wrists. Just inspect. I don't see any nodules. I don't see any swelling. Everything appears normal here. Okay, so hold your hands up like this. Go down, back up. Okay, you can go from side to side. Can you do this maneuver? Good. Okay, open them up and hold them like that. Don't let me push them together. Okay, very good. And make a fist. Okay, good. And against resistance, it's kind of, okay, put your hand up and then push against my
Spirit
hand.
hands.
Okay, pull back against my hand. Okay, good. So that's how you can test resistance with those. Can you push fingers to every one of your, thumb to every one of your fingers? Now hold on to your pinky and don't let me pull through. Good. Now I'm going to check hand grip strength. So grab my fingers like this. Make sure your fingers are crossed. Squeeze as hard as you can both sides. You were trying really hard there. Okay, so special test, I'm going to check and see if you have carpal tunnel syndrome. I'm going to tap here. Do you get any like tingly feelings in your hand? So that's Pinnell's tapping. Can you hold your hands together like this? And just tell your SP, I would have you hold that for 60 seconds and see if you got any numbness or tingling. Oh, and then Allen's test. So the Allen's test, I'm going to occlude both the radial and the ulnar. You don't have to be that specific in making sure you find them. You will know if his hand blanches if you're actually on both of them. So I just put my thumbs here. Okay, now pump your hand up a couple times. Okay, so let's turn nice and white. I'm going to let go of ulnar and make sure it pings back up. And it does. Okay, so you have ulnar sufficiency. Any questions on the hands? All right. Knees. Inspect, looking at hair, everything looks fantastic. Now I'm going to palpate, kind of relax your leg for me. Suprapatellar, with patellar pouches on either side, infrapatellar. Any pain with any of that? Excellent. Okay, can you put your foot straight out? Put it back. Good. Now push against my hand and pull back against my hand. Excellent. What else can you do on these while you're sitting? Is that it? Okay, so feet and ankles again, everything looks fantastic. Did we miss one? No? Okay. So we're inspecting, we're going to palpate everything. While we're down here, we will palpate the Achilles tendon. We're also going to squeeze together, and we're looking for, what's that called when you pain? Right, Morton's and aroma. Very good. Again, we're going to do range of motion. Pull your foot up against me, push down against me. Okay. Can you push inward toward me? Okay, and out this way toward me. Excellent. We can go ahead and do the pulses while we're down here as well. So posterior tibial, back here. The dorsalis pedis, right here. You can also do capillary refill while we're down there. Your whole foot is orange, so there's a problem.
There is, John. Real bad.
What else? We can do anterior drawer while they're sitting this way, or you can wait until they lay down, either way you want to. So again, we just pull out, push back for posterior. No problems, I don't feel any laxity there. What else can we do while we're here? Oh, we can do the talar tilt. So you invert the foot, and then you want to push your thumb right underneath the lateral malleolus. Do you have any pain there? Okay, excellent. Hammond's test. To see if we have a DDT, I'm just going to squeeze real hard. Does that hurt? We can do extremity limb circumference as well. You don't have to use a fantastic ribbon, but I do. But you can, because you just mark how big that one was, and then keep that mark, and check over here and make sure they're about the same. And they are. Okay, anything else on these?
Is there gonna be like a tape measure and all that stuff already in the room, or do we need to bring that kind of stuff?
I would bring a tape measure. They usually have everything else for you.
Okay.
But I'm not sure there are tape measures in there. Have you guys seen them in the drawers?
I haven't seen one, but
Okay. So a tape measure or anything, any length of something will work.
okay.
Just verbalize the rest. Just do the calves and verbalize everything else for
Yes.
the circumference.
Well, actually, we're going to, when he lays down, we're going to do some other stuff. Yeah. Yes, ma'am?
Say that you finished your physical exam and then you remember something, like say you're sitting and you remember something that you were supposed to do while you were standing. Would it be more productive to make him stand up and then do those things, or just the normal?
I would have him go ahead and do them. Because the SPs don't really know the rule about you can't move more than 3 times, so that's more our rule, but. Yeah. No, if you remember something, go ahead and have them do it. Okay, I think we're going to have you lay down right quick, but let me make sure I haven't forgotten something else. Okay, go ahead and make yourself supine. Yes, please. Did I go back? Okay, so first I want to do jugular venous pressure. I'll have you lay flat. And this could be something that you might just verbalize to the SP. Say, I would normally have you lay flat for a few minutes, and then I would raise your bed up to 45 degrees, and then I would check the level. I should have. And this doesn't necessarily, the one that goes horizontally doesn't necessarily have to be a ruler. It can be anything that's straight, because you're actually measuring from the one that's on the chest, right? That's where we're getting the measurement. So we will assume he's at 45 degrees. I'm going to find the sternum, come over to the midclavicular line. This is the one that I'm looking at to measure. And then I find the top of his jugular venous pulse, go right across, and it should be less than what? Do you guys remember?
7, 5 plus 2.
Right. Should be less than 9, so we add 5 to it, right? Or 3. Oh my gosh.
5 and then
Right,
2 to
5.
4 is your normal.
Right,
How about that?
okay. And that's all you do. Again, verbalize it, and the SP may go, okay, you don't have to do that one. But if they do, remember that's how you do it. Okay, excellent. Now again, I'm going to look at your chest, see if I see any palpations now that you're laying flat. I can feel for the PMI. Probably you're not going to feel it on your patients. Don't feel anything there. You having fun?
I am.
Okay, then we auscultate again because now they're laying down. Really, but auscultate again. So all 4 spots, bell and diaphragm. Then we will inspect abdomen. What else did I miss on the heart? Anything? No? Okay. So inspect, do you mind if I look at your abdomen? Okay. So now that we're so close and all. So inspect, look for any pulsations, look for any abnormalities, and you just say, I don't see any striae, I don't see any pulsations, I don't see any abnormalities. Now remember, this is the part where we auscultate first before we palpate, right? So I'm going to auscultate 4 quadrants. Then you could go ahead and flip over to your bell and listen for bruits, aortic, renal, iliac, femoral. Don't hear anything.
Can we be that speedy with our SPs?
No. Unfortunately not.
Hey, Shelley, on here it talks
Yes.
about auscultate. This is back at the heart, unfortunately. Sorry. Auscultate with diaphragm and bell in supine and lateral positions.
Oh, I'm sorry, yes.
The lateral positions, that just changes the inflow and whatever.
Right. And it also moves, it physically moves the heart within the chest wall. So to make supine, just lay over on your left side for me, please.
Are you wanting me to do that?
Yes, please. Thank you. And so that kind of and then I would auscultate. Sounds awesome.
She's blushing. I think
know.
Shelley's blushing.
Okay, lay back down. Remember me not to let Alex be the patient for anything. Okay, so we're still feeling of abdomen. Now we're going to palpate gently in the 4 quadrants. I think I forgot to do a little scratch test while we were doing the listening. So remember liver scratch test? You can either do your finger or you can do the end of your little thing. You can skip it, yeah, right.
Like,
Just let that be one of the 50 you're not gonna
Brandy said that.
absolutely. In theory, you can do spleen as well. Honestly, I've never done that on a real person, even when I thought they did have an enlarged liver. If I can feel it, it's enlarged, and you're getting some kind of imaging study at that point. Okay, so we're palpating. We're going to palpate for the liver. You can do hooking if you want to for the liver as well. Girls, ladies, and gentlemen, make sure your fingernails are nice and short so you don't hurt your SP. Mine aren't today. Okay, and then the special test we do, of course, we want to do McBurney's point to check for appendicitis, right? Say, does it hurt when I push here? Rovsing's is if I push over here, but it hurts over here where the appendix is. Rebound, I push down, it hurts worse when I let go.
Are we supposed to name the tests as we're going through them? Or can we just be like, pain, it's like, or do we need to do it? No,
Hurt. I would probably say them out loud. I mean, for me, I said them out loud because it helped me remember what I was doing too. And I was like, and I'm doing McBurney's, and I'm doing, okay. So push up on my hand, please. So that's psoas, obturators, this way. Okay, push it up against my hand. Any pain? No? Okay. What? No? Now I'm going to push up on your rib. Take a deep breath in. And as you blow out, I'm going to push in. I'm going to push really hard. So Murphy's for gallbladder. Any problems there? What else did we miss? Anything? Allotment. You guys know how to do that, right? You just push down, let go, but keep your hands on it, right? Shifting dullness. The fluid wave. Your hand doesn't work right. Put your hand right there. I push one side and make sure I don't feel it on the other side. Thank you. Shifting dullness would be as you were percussing, which I apparently left out altogether. As you were percussing, you notice some dullness, so I hear it here, and then I'd have the patient turn to the side. You don't have to, and then I'd listen again and see if it moved. Any questions on any of those special tests? Okay. Good. I'm afraid to even get near you at this point. Okay, so hips, you can do range of motion with hips with them laying down. I always remember that picture of the guy in the little black Speedo pants, on the lecture. And he's like getting examined in a basement or somewhere with it's crazy. On the PowerPoint. Okay, so we can do, just relax your leg for a second. Just relax your leg for a second. Relax your knee for a second.
My knees don't work.
Oh my gosh. So flexion. Now extension is hard to do like this. I'll probably have to do that when he's standing up. Remember, this is external rotation because the leg's coming out. Internal rotation. And we'll do those against resistance while we're doing all of them. What else do we need to do on the hip while we're laying down? We do all the
abduction and
ITV and
adduction.
stuff.
What about abduction and adduction?
Yes. So abduction, push against my hand. Good. Adduction, push against my hand again. Good. Okay. Excellent. Now, and then we'll finish the knee exam here that we didn't do before. So we can do McMurray's. Remember, we're checking for a torn meniscus. I'm going to hold the bottom of the foot. I'm feeling here for any crepitus. I'm going to turn the foot in, straighten your leg out. Okay, back up. I'm going to turn your foot this way. Okay. I'm going to check for any medial or lateral collateral ligament tears. So with hand on the thigh, I'm going to push the leg this way for the lateral. Any pain?
No.
Okay, and I'm going to switch for the other side and kind of open the knee up. Any pain? Okay. What other special tests for the knee? We can do allotment. Patellar apprehension. Does that hurt? Does that hurt? No. Limb length. Remember, you go from the outside of the top of the ischial spine there, find that, all the way across to the medial malleolus.
The Lockman test is same for anterior drawer, yes?
Yes, and I'm sorry, on the initial one I had sent out, it said Lockman test, but that's anterior drawer. Okay, you are 3/4 of a ribbon long. Let's make sure you're the other side
I mean,
as
they're
well.
different tests, but they test the
And
same
that's
thing.
Okay, very good. Straight leg raise, and I'll do the Hoover at the same time. So I'm going to put my hands under both of your ankles. And go ahead and lift this leg straight up for me, please. Any pain in your back? Okay, how about the other side? And I can feel him pushing down with the other leg, so I know he's really trying. He's not just malingering to get drugs out of me. He normally does. Okay, so Patrick Faber, I'm going to push here. And then I push down on this hip and this knee. And see if he has any pain in his SI joint. Does that hurt? No. Okay, excellent. Okay, so sensory, make sure you don't have meningitis. I'm going to just have you raise your head up for me. If he did, his knees would come up at the same time. Go ahead and relax. And then at the other end, let's raise your legs up. And then straighten them out and lay him back down. And if he did have meningitis, his neck he would kind of curl up like that. Doll's eyes. So what you're doing is say, I want you to look straight forward and keep your eyes forward as we move back and forth. Okay? Well, not like that. I want you to move your eyes with your head as we're going across. You may be in a coma, sir. I am not sure. You want to make sure that the eyes track as you move their head. They should move a little bit. If they just stay straight line and don't move at all, then that means they're in a coma or they have severe brain damage. I'm sure that's not your case at all. Okay, we're going to finish this up with you standing, so I'm going to ask you to please stand here for me. I feel like I missed a knee thing, but maybe because they were out of line.
There's an O'Bear.
Oh, bear! Dang it. Will you lay back down for a second?
Failed.
I know, I probably did.
That's two.
That's two. Yeah, and now if I have another body change, go ahead and lay back down on your side. Okay, so you remember O'Bear, we're checking for IT band tightness. Make sure the hip is nice and straight. Go ahead and bend your knee for me. Okay, straighten it up all the way. Straight. Okay, now let your leg fall down. And if they can't let their leg fall all the way down, then that means they've got IT band tightness. Okay, all right, go ahead. They're tight, you won't see anything.
Just in case. I don't want to fall out.
Okay, now this you can just verbalize. You can say, now while I have you up, what I would do is if I heard anything abnormal, I would listen to that sound, that spot where while I have you squat down and squat for a few minutes and then stand back up and listen to see if it changed at all. Okay, so we'll do the Romberg. Go ahead and turn around this way. Towards me, please. I'll sit down this way. Okay, put your hands out in front, and there are varying ways to do this. You can have hands out in front, hands down at side. Doesn't really matter. We put hands out at front. And close your eyes for me. And then you just wait to see if they fall over. Oh, feet together, I'm sorry. Make sure feet are together. So with your SPs, I'm always right here with the real patient just in case they do fall over. Okay, good. You can open your eyes now. Stand on one foot, please. You can move your hands down to your side. Now hop on that foot. Okay, and I would have you do the same thing on the other foot. Now just walk over to that podium and back for me. Or just walk over there. Now turn around and walk heel to toe, so foot right in front of one another. Excellent. Okay. Now turn around and scoot back this way a little bit. Go ahead and face the board for me. Okay. So I'm looking at symmetry, make sure the gluteal folds are the same on both sides. I palpate. I can see, they look pretty good. Okay, see, okay. Okay, so we're palpating everything. Now I would like you to bend forward, please, flex at the waist. And while they're bent forward, that's impressive. Good, very good.
You want me to go further?
Just a little bit, just so I can at least look at your. So as they're bent forward, of course, you're looking for scoliosis too, which means one of their scapula would be higher than the other one. Okay, go ahead and stand up for me. Now can you flex backward? I know you can. Okay, good. Go ahead and stand up. Okay, now down one side. And the other side. Okay, now I'm going to hold your pelvis stable and I want you to rotate around. Okay, good. Good. Excellent. Okay, now we're going to do Trendelenburg. So I'm standing here, just stand to pick up your left leg, please. Okay, and again, we're making sure that this side goes up, right? Meaning it's strong enough to hold you. And if it didn't, if this side fell down, then that would mean you would have weak muscles. All right. Chaubert, remember, is when we measure. So let's say I found the top, the gluteal cleft right there. I would measure up 10 centimeters. We're just going to assume I did. So I'm going to measure up 10 centimeters and mark it right here. Okay, now bend over as far as you can for me. I'm going to find the gluteal cleft again and measure again, and it should be at least 15 at this point because it stretched that far. Okay, thank you. Okay, now I want you to put your knee on this chair for me. And I'm going to squeeze right here on your calf muscle. And I'm going to look for any excessive opening of the joint down here and for him to express pain in that area when I do that. Okay, what else do we need to do? Is that it? Did we miss anything else standing up?
Knee extension.
Palmar drift.
Or hip
Is that part of it?
extension was the only.
Oh,
other
that's
thing.
right. Excellent. So while you're standing up, go ahead and put your leg out behind you. Excellent. All right. Thank you very much, Mr. Sherry. Put your clothes back on. Have you guys ever heard that Rodney Carrington song? It's awesome. I won't sing it for you now because Eric's here, but he weren't. I thought he would. In French. Okay, any last minute questions on it? It's really not that bad. Yes.
Do we actually take the temperature, weight, and height?
No, no. And I know it listed on that original, but you don't need to get their weight, their temperature, height, because you won't have access to that, and you don't have time. And keep in mind, you're not doing any kind of history. You're just going in and doing the physical.
Shelley,
Yes,
we talked to the SP when we were in there for the SPBL
Mhm.
yesterday. They said that it is helpful if you're gonna do, if you bring in a sheet, because even though they do it on the computer, they may, if the person watching can
Okay.
keep track on the sheet, then they can use that sheet to like document it on the computer.
Okay.
But it's just, you know, it's not required, but they said it might be helpful, especially
Okay.
if you do things in a weird order, so.
That's true. Did everybody hear that? So some of the SP said if you will bring in your sheet, then it will help the other person mark it as you go along. And our neuro exam is a little bit different than their neuro exam. I think we're going to change that next year, but it's a little bit different. But they know it's different because we've done it this way every year. So
Yeah. Since there are a few like differences between ours and theirs, like is the sheet like you provided for us, like is that, I mean, is that
Yes.
something that they have, like is that adequate?
yes, and if there's ever a question, they always come out and say, "Do you have them do it this way or this way?" And then I can clear it up for them. Yes, ma'am.
Oh, yeah.
You don't have that yet?
It just
Oh.
has block time, we don't have like a.
Is it
You will know hopefully by the end of today when that is.
is it a 45-minute or hour?
Hour.
Hour.
You'll get an hour block to do it.
Okay.
Do we know when the clock starts, or does it start as soon as you walk in the room?
I think we'll do the doorbell thing because we're recording it. So you'll get the ding dong and then you walk in and start. Hey, Vaughn. Candy Graham. That's what you should say when you Any other questions? What's wrong with questions?
You
If you
wanna
have
watch
any
your
questions,
stripper
just
video?
email me. I'm sorry.
So do you wanna watch your stripper video?
Yes, I do.
Well, I had